Hello, my name's Ed Hope. I'm a junior doctor in the UK, and this is my jargon busting guide to The Resident.
A 39-year-old male with a history of diabetes mellitus pancreatitis due to increased triglycerides presented with abnormal LFTs and a heterogeneous liver mass.
Getting bombarded like this is super realistic, so I don't think I got them all down myself. But let's pick them apart a little bit. Pancreatitis, whenever we hear itis on the end of anything, it means inflammation. So pancreatitis is inflammation of the pancreas, particularly nasty one that. Increased triglyceride, so that's just increased sort of fats in the blood. Heterogeneous liver met, so a liver met is a cancer that's gone from one place to another. So they tend to spread to the liver quite often because the liver has such a good blood supply. So there's obviously a tumour somewhere in the patient that's now spread to the liver.
He's unconscious. He needs thrombolysis.
Activate the interventional team.
Okay, so the patient needs thrombolysis and they become unconscious because there's a blood clot going on somewhere. So thrombolysis means where we give medications that break down a clot, because thrombo means a blood clot and lysis means breaking down.
Code blue and ED alpha.
Get them out of here. Start compressions. You're running the code.
I've never run a code.
Do you want an amp of Bicarb?
He's in charge.
Okay, so we've got a cardiac arrest situation here. Patient's heart stopped beating, so we're going to have to beat the heart for the patient, so that's why we're doing chest compressions. They've asked for an amp of Bicarb. I haven't really seen that in a cardiac arrest, but it is often used if we're suspecting acidosis. So Bicarb is a kind of alkalotic solution, so if we put that into the bloodstream, it will kind of neutralise it and stop any acidosis. Acidosis in the body, pretty nasty.
It's probably a superficial phlebitis. Change her IV and give her 25 of diphenhydramine.
Okay, so superficial Phlebitis, a bit of a mouthful that one, isn't it? But superficial means something that happens near the surface of the body. And itis, as we talked earlier, means inflammation, and phleb means, we may have heard of phlebotomist, that's someone who takes blood from a blood vessel. So phleb, we mean blood vessels. So superficial phlebitis means inflammation of a blood vessel that's very close to the surface of the skin. So that completes our jargon busting guide to The Resident. I hope you learned things along the way, so next time you watch it, you'll know exactly what everyone's talking about. And I hope you had a bit of fun along the way too.
The Resident returns Tuesday at 9, brand new and exclusive.